A very good morning to everyone. Today, we all have gathered here to celebrate World Health Day 2022. And it gives me an immense pleasure to extend to you a very warm welcome on behalf of Community Health Nursing Department, Shri Guru Ramdas College of Nursing, Amritsar. I extend my welcome to our Honorable Chief Guest, Dr. Daljit Singh Ji, Vice Chancellor, Shri Guru Ramdas University of Health Sciences, our Principal Madam, Dr. Parvez Saini, Vice Principal Madam, Dr. Manpreet Kaur, all the teachers, the distinguished guests and speakers who have joined us online, and all the students. World Health Day is celebrated every year to commemorate the anniversary of foundation of World Health Organization in 1948. And every year a new theme is chosen. This year, in face of COVID pandemic, a polluted planet and increasing burden of disease, the WHO has chosen the theme that is Our Planet, Our Health. This theme focuses on global attention for urgent actions to keep the humans and planets healthy. Now, I invite our Honorable Principal Madam, Dr. Parvez Saini, to please extend a very warm welcome to our audience. Welcome, Madam.
Honorable Chief Guest Speaker, speakers, faculty, and my dear students. Good morning, everyone, and a very warm welcome to all of you on World Health Day celebration on the theme, Our Planet, Our Health. So we know that it is celebrated every year globally on 7th of April. And this year, as based on the theme, WHO, they have planned. So WHO will focus global attention on urgent actions needed to keep humans and the planet healthy and foster a movement to create societies focused on well-being. So WHO will work to make our planet and our health healthy so that everybody should be benefited. And we as being professionals have to work hard to achieve their target. So with this, I wish you all a very happy WHO Day. So I, Principal SGRD College of Nursing, feel extremely honored to welcome our Chief Guest, Dr. Daljit Singh, Vice Chancellor of Shri Guru Ramdas University of Health Sciences. Sir is a renowned pediatrician, ex-principal of Dayanand Medical College, Ludhiana, and have lot many contributions toward the society, which I cannot express in my words. So we're really proud to have such a great personality with us, with such an enthusiasm. So I'm sure that we'll reach a lot through Sir message. So I'm thankful to Sir for accepting our invitation out of his busy schedule and making his virtual presence here. Next, I would like to thank and extend my deep sense of gratitude to our Honorable Administrator and Dean, SGRD University of Health Sciences, Dr. A.P. Singh. I send a very warm welcome to you, to Sir, as without the help of Sir, nothing would have been possible to organize such an, even the virtual programs, because he is the one only who is helping and always stand as a pillar of strength with us. My gratitude and respect, and also very warm welcome to our today's speaker. So I welcome to Dr. Sushma Saini, Professor Community Health Nursing Department at 9 PGH Chandigarh. So Madam will be deliberated on the topic climate changes and its impact on disease profile. So I welcome you, ma'am. And I extend my warm welcome to Dr. K. Rajeshwari, Assistant Professor, AIMS Rishikesh, and she will be throwing light on climate changes and its impact on food and water supply. I extend my warm welcome to Professor K. Punita Lakshmi. She is Principal, JIET College of Nursing, Jodhpur, and Madam will also be putting light on climate changes and its impact on mental health. And I welcome Dr. Utal Baksha. He is professor at BVS Sajleshwar Institute of Nursing, Karnataka. And sir will be putting light on nurses' role in combating climate changes. So with this, I welcome all the students, all the nursing faculty, and the participants who have shown their interest to participate in different competitions to make this event a success. So I deem a great privilege in welcoming you all, and once again, I wish you a happy WHO Day. Thank you.
As the light destroys darkness, in the same way, the knowledge destroys ignorance. So now we will have our traditional auspicious lamp lighting ceremony that will be conducted virtually. I request all of you to join us for virtual lamp lighting ceremony. Thank you, everyone. So beginning with the event, now I request our respected chief guest, Dr. Daljit Singh Ji, Vice Chancellor, Shri Guru Ramdas University of Health Sciences, Amritsar, to address the audience and share a few words from his knowledge and expertise with us.
Good morning, everyone. Dr. Saini, Principal, our worthy faculty members for this program, Dr. Rajareshwari, Dr. Lakshmi, Dr. Utal Basha, and all the other senior faculty members and delegates and friends. It's a pleasure to be here with you today at this special occasion of the World Health Day celebrations. And I am glad that our College of Nursing is organizing this virtual program. I think many people will benefit from this. You're already aware of the background of the WHO Health Day, which I don't need to repeat. And I also do not need to reiterate that the theme for this year is very clear: our planet, our health, which I feel is a very, very relevant topic in today's world, especially after the COVID pandemic, which we have suffered over the last 2 years and which has really created havoc, especially for the health and also for the other aspects of human life. Now, we are all aware that health is defined by the World Health Organization as a complete physical, mental, social well-being, and not just the absence of disease. We know that definition. And we also know that the health is very closely interlinked with our environment. For any disease, there is a relationship between the host factors and the environmental factors. And of course, if there is an infection, there is an additional agent factor. But the common to all these diseases is the environmental factor, which is extremely important. Unfortunately, we human beings have really played havoc with our environment, and we have damaged our planet to a very large extent, whether it comes in terms of the all forms of pollution, the air pollution, water pollution, soil pollution, even noise pollution for that matter, and all forms of imaginable forms of pollution, degradation of land, a scarcity of water, gas emissions, burning of fossil fuel, misuse of plastics, unsafe and unbridled industrialization with all the bad effects which it has spread while in the context or under the pretext of development. And then all this leading to very severe damage to our planet in terms of depletion of the ozone layer, the global warming, and a massive effect on the climate. There's some muting required for some of the audience. Anyway, so this effect on the climate is something which we have created to a very large extent, because on one hand, we call it Mother Earth. This is our Earth. And at the same time, we have made our planet to be really crying. I mean, our planet is crying. And when that happens, it is not difficult to imagine that in turn, the mother is punishing us. That means we are having our health damaged by our own doing. For example, if you just see the facts and figures which are going around, 90% of all of us are breathing unhealthy air because of all the air pollution which we have created ourselves. And the heating which we have produced has given rise to many more diseases which are being spread, especially like mosquito-borne diseases, which have gone up very intensely over the last few years. And then we have the so-called progress in development in terms of processing of food, and so highly processed food and beverages, which are now bringing in new diseases like an outbreak of, you can say, obesity, of cancer, of heart disease, and so on. And so I was reading a recent estimate that 13 million deaths are occurring every year because of avoidable environmental causes. This is something which is very, very alarming. And so this climate crisis, which is now happening in our environment, is also a health crisis. And therefore, this theme which the WHO has given is very, very appropriate: our planet, our health, because these two are closely related to each other. One cannot have progress or a kind of a healthy situation without the other. So what can we really do about it? We simply have to eliminate the bad practices and the wrongdoings which we humans have been doing. I think it needs a comprehensive approach from everyone. We have to make decisions at all levels: political decisions, social decisions, commercial decisions. All should be in such a way that not only are we having progress, but at the same time, we are preserving our planet, we are preserving our climate. I'm very glad that I was just seeing the program for today, and there are talks on the effect of climate on various aspects, including health. And I think these will be very, very important for all the audience, especially the students, to understand that this is something, it is not just beyond us. A climate is not something which is happening by itself. We have played with nature and we have created this situation. So it is up to us to correct it also. And I hope that all of us will do whatever is possible in our own field, at our own level, wherever we are, to make sure that our planet is safe so that our health is also safe. So I congratulate all of you for organizing and attending and participating in this very important virtual workshop conference. And I'm very glad that you're covering very important topics. My thanks once again to Dr. Rajareshwari, Dr. Lakshmi, and Dr. Uttal Pasha, and all the others who are participating. And again, congratulations to the Department of Community Medicine Nursing in the College of Nursing of SGRD University. Thank you very much.
Thank you, sir. It's always an honor for us to hear from you. You are an idol of knowledge, experience, and inspiration for all of us. Thank you, sir. Thank you very much. Now we will have a brief virtual orientation of our university, Shri Guru Ramdas University of Health Sciences, Amritsar. It is a university with a vision to promote excellence in higher education courses in the health sciences, and it is constantly committed to make a significant and positive contribution to address the health needs of society. Now let's have a look at the video.
Healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. With this motto, we are leading the charge and putting our contributions to public health at Shri Guru Ramdas University of Health Sciences, which constitutes a medical college, a nursing college, and a 900-bedded tertiary care hospital situated in the holy city of Amritsar. Shri Guru Ramdas Charitable Hospital came into existence in the year 1977. At this institute, all our motives are driven by the vision of producing excellence from dissection till reconstruction. The university is synonymous with prowess in health sciences. It is the epicenter of quality healthcare services for the underserved population and at the same time provides in-depth training for undergraduates and postgraduates. Talking about numbers and statistics, we take in 150 students for graduate courses and 60 students for postgraduate courses annually. In addition to this, the College of Nursing admits more than 100 students annually. Keeping in mind the importance of basic clinical skills, a simulation lab has been recently set up to provide immersive learning experiences for graduates as well as postgraduates. Simulation lab has been recently set up to provide immersive learning experiences for graduates as well as postgraduates. The lab has lifelike clinical sim lab rooms, mannequins, and equipment, allowing learners to develop expertise of basic and advanced procedures without any risk of patient harm. Shri Guru Ramdas Rotary Cancer Institute, established in the year 2000, is dedicated to the selfless service of cancer patients. The hospital is a premier medical institution in North India for the diagnosis and treatment of cancer. We are pleased to launch the Fellowship in Palliative Care for desirous applicants across the globe. The hospital has 14 operation theatres stocked with state-of-the-art monitors and anesthesia workstations. There is a dedicated medical ICU, a surgical ICU, a neonatal ICU, a pediatric ICU, a cardiac catheterization unit, fitted with an array of leading-edge technology. The lecture theatres provide an indulging and immersive learning experience in conjunction with well-furnished laboratories where students can lay emphasis on the extremely vital practical aspect of sciences. Expressing our concern for public health, a hospital-based cancer record system has been set up in association with Tata Memorial Institute, through which we are constantly gathering cancer-related data for North India. This data empowers us to predict the prevalence and patterns of the disease while also promoting research for better management. Putting our best foot forward to deal with this pandemic, a molecular diagnostic lab has been established for diagnosing COVID-19. We have also achieved a significant 86% recovery rate for patients with stage 3 COVID. We are proud to share with you our plethora of international collaborations for student exchange programs. Under the aegis of UNITO, our institute has been selected for the implementation of environmentally sound management of medical waste. The project is first of its kind in India. As an effort towards societal benefit, free medical camps are held 4 times a year. The founders of this institute came up with the splendid idea of the All India Sports and Cultural Festival, Resonance. Medicos from all over India reach our university to participate in the most awaited gala of the year. We invite you to continue your quest and explore all that Sri Guru Ramdas University of Health Sciences has to offer.
Respected Vice Principal, Madam Dr. Manpreet Kaur. Welcome, ma'am. Thank you, Ijjot. So once again, good morning to everyone, and I hope everyone sitting over here physically, we have BSc Nursing final year students sitting over here physically with us, around 100 students. And of course, virtually we have participants which are seeing this event through Zoom as well as YouTube. So the most awaited moment for which this program was planned, that is E-Symposium. And E-Symposium we have planned on the theme which is given by World Health Organization, that is Our Planet, Our Health. So putting attention upon environment, about the climate changes and how it is affecting our health. So all these topics we will be covering in this E-Symposium. The first one would be climate changes and its impact on food and water supply, which will be taken up by Dr. K. Raja Rajeshwari. She is Assistant Professor, AIIMS Rishikesh, followed by climate changes and its impact on disease profile, which will be carried out by Dr. Sushma Sani, lecturer, 9 PGI Chandigarh. Then we have climate changes and its impact on mental health. Professor K. Purita Lakshmi she is principal, JIET College of Nursing, Jodhpur. And then of course we have nurses' role in combating climate changes, which will be taken up by Dr. Utal Basha Darnagiri. He is Professor, BVS, Sajjalashri College of Nursing, Karnataka. So all these topics we will be covering in this E-Symposium. And as we know that since the inception of human civilization, our political, social, and commercial decisions, which are taken up by individually, collectively, by our government, these are driving the climate and health crisis. And as VC sir was also pointing that 90% of all of us, and I think this figure is the global one, in India, of course, it is more. Every year we are witnessing smog and then the related respiratory problem. So I think it is 100% people in India, we breathe unhealthy air, which is resulting from burning of fossil fuels. And heating world is seeing mosquitoes, which spread diseases farther and faster than ever before. And we are also seeing re-emergence of so many diseases and even the new diseases. And the COVID-19 is the latest example. Then along with that, extreme weather events and water scarcity, these are displacing people and affecting their health. Pollution and plastics, which are now found even at the bottom of our deepest oceans, highest mountains, and even have made their way into our food chain, for which we really need to be very much concerned about. And all these systems, these produce highly processed, unhealthy foods and beverages. These are also driving a wave of obesity, increasing cancer and heart diseases, while generating a third of global greenhouse emissions. And with this idea, we have planned this symposium so that each one of us become sensitized toward this issue about our environment, about climate changes, and of course, how it is impacting on our health. Because alone we can do little, but together we can do so much. That's togetherness is required. And of course, our individual action with which we don't need any order, we don't need any instruction. It has to come from within, individual, and then of course collective action. It can bring significant changes, and of course we can protect our planet, because there is no planet B to live in. This is earth only, which we are supposed to protect and preserve. So that's how I'm going to start with the E-Symposium. I'm going to call up the first speaker, that is Dr. K. Raja Rajeshwari. She is Assistant Professor, AIMS Rishikesh, and I will briefly introduce her profile. Slide, please. Okay, so we have Dr. K. Raja Rajeshwari, very esteemed guest speaker for this session. She is Assistant Professor, College of Nursing, AIMS Rishikesh. She is MSc Community Health Nursing along with PhD in Nursing, and she has experience of around 24 years. Since 1997, she has been working in various capacities like staff nurse, clinical instructor, nurse researcher, nurse educator in private institutions as well as in government institutions. And she is a lifetime member of multiple associations. We are very glad to have with us Dr. K. Raja Rajeshwari. So over to you, ma'am.
Thanks a lot. Good afternoon, everyone. Am I audible to everyone?
Yeah, good afternoon, ma'am. You are audible. Okay.
So I would first of all like to thank the organizing committee of this E-Symposium of SGRD on this World Health Day. Theme is Our Planet, Our Health. And I'm going to briefly discuss on climate changes and its impact on food and water supply. Actually, host has disabled the screen sharing. Can you please enable me to share my screen?
Yeah, sure, ma'am. Just 1 second. It's already enabled, ma'am. You can start sharing your screen.
Okay, thanks. Hope my screen is visible.
Yeah, ma'am, it is visible. You can start.
But actually, I'm unable to put it on slideshow mode. When I click it, it is not moving forward.
Sometimes it happens with Zoom. Ma'am, you can present with this view also.
Okay, is that okay with you all? Okay. Okay. So climate change and its impact on.
If once again you can, yeah, now it's visible.
Okay. So climate and food systems, as we all know, it is closely interrelated. So in anything that changes the climate, it can directly affect the availability of food. So this means if there is frequent floods and there is drought, then there is disruption in agriculture, and what happens is after that there is changes in the yield, and there won't be any available land, arable land. Arable land is nothing but where we can grow crops, and the water for agriculture will be less. So this is like a vicious circle. So climate change and food and water supply are interrelated closely. So as you see this graph, you can see the three layers of this graph. So the bottom layer says about the carbon emissions, and the next layer, the beige layer, shows the carbon dioxide concentration, actually because of the change in the land use, because we have done a lot of deforestation, and we have been constructing concrete jungles actually. So to we create land for agriculture and things like that. So that beige graph shows the carbon dioxide concentration. And the next thing is the pink graph. That pink graph shows the fossil fuel emissions actually. So this graph basically shows the under the 1,000 years. So changes over the past 1,000 years. You can see a sharp rise now. So am I audible actually?
You are audible, you can continue.
Yeah, okay. So what happens if we don't intervene? What will happen? The doubling of people living in water stressed basins will happen by 2050. And in some African countries, rain-fed agriculture may become half by 2020. And increasing population at risk of malaria in Africa by 170 million by 2030, and at risk of dengue by 2 billion by the year 2080. And increasing exposure to coastal flooding by a factor of 10, and land area in extreme drought by factor of 10 to 30. So these all can happen due to the climate change. So what happens to the health effects? So some expected impacts will be beneficial, but most will be adverse only. So expectations are mainly for changes in frequency or severity of familiar health risks. So human exposure, like regional weather changes, and then the heat waves, extreme weather changes, and changes in the temperature, increasing temperature, and precipitation. And there are some modulating influences also, like contamination pathways are there, transmission dynamics, agroeconomic, ecosystem, hydrology, and then socioeconomics and demographic. All these have a greater impact, and this causes the health effects. So what are all the health effects? Temperature-related illness and death, extreme weather-related health effects, air pollution-related health effects, water and foodborne diseases, vector-borne and rodent-borne diseases, effects of food and water shortages, effects of population displacement. All these becomes the effects. So what happens is the world's land and water resources are exploited. We are exploiting. So as the guest speaker said, we are exploiting it. So we exploit it at an unprecedented rate. And along with that, when we have climate change also, we cause dire pressure on the ability of humanity to feed itself. That is what the UN report prepared by more than 100 experts from 52 countries have said. And they have said that 500 million people already live in places turning into deserts. And the soil is being lost between 10 and 100 times faster than it is forming. And what happens? Climate change is creating threats like floods, drought, storms, and other types of extreme weather. It shrinks the global food supply. Actually, the global food supply is shrinking. And more than 10% of the world's population remains undernourished, and food shortages can lead to increase in the cross-border migration. That is why people start migrating from one place to another in search of food, basically in search of food. So the cross-border migration happens because of this climate change indirectly. Like climate change, it causes food shortages, and then it leads to cross-border migration. Next is climate change can impact the water resources drastically. So by means of drought, and then we are already facing the amplified risks like drought, flood, water supply shortages, and whenever there is flood, whenever there is rain, more rain, and there is flood, and then flash floods, poor water quality, disrupted watershed processes, and so on. So climate change increases the risks and problems and stakes. So that is what, as I told you earlier, it is just a vicious cycle. It goes on and on. So we have to stop somewhere. And the potential climate change impacts to water is like less snow, there is more rain, increased winter flooding. Even during winters, winter flooding is more, and then less snowpack. And snow starts melting earlier. Earlier, I can tell you, like earlier we used to wear sweaters in March in Rishikesh, but now we can't do that because it is so hot. And that is because of that. So increased temperature, so there is earlier snow melt, lower summer stream flows, and then increased stream and lake temperature, increased risk to aquatic ecosystems and fish species, and longer, warmer growing seasons. That's what I meant to say. Like it is so warm these days, and increased and decreased forest growth and ecosystem productivity because of deforestation. All these are happening because of deforestation. That is why we stress on planting more trees. And warming surface waters, intense droughts. Everywhere you see there is less water, less land water, and then there is more drought, longer and more severe fire seasons. And wherever you go, forest fires is more these days because of increased heat and increased insects and diseases also. So the global water strategic objectives were developed by the US Agency for International Development and the State Department, like global water strategy. This was developed in 2017. It says that increasing sustainable access to safe drinking water and sanitation services and adoption of key hygiene behaviors, and encouraging sound management and protection of freshwater resources, and promoting cooperation on shared waters. Always now there are some movements of river merging also, that is also happening, because we want to promote cooperation on shared waters and strengthening water sector governance, financing, and institutions. So what happens to the agricultural sector? Increased frequency and intensity of droughts and floods, heat waves, and other extreme events directly threaten the food productivity. When there is very less productivity and soil health is bad, it leads to severe food shortages. So it results in the high food costs. So thereby, if there is food shortage, then it results in the rise in the food cost, affecting the livelihoods of producers, spending capacities of consumers, and success of food-related business alike. And then food shortages are likely to affect the poorer parts of the world disproportionately. And this makes the food system particularly vulnerable to change, especially in an agrarian country like India, our own country. It is very difficult. And what happens to the crops? By the year 2100, there will be a decline in the production of major cereal crops, 20 to 45% in the maize yield, 5 to 50% in the wheat, and 20 to 30% in the rice. So contribute to reduced production. This climate change is contributing to reduced production, spiked food prices, and it will become difficult to cope up with the rising needs of growing population. That's why we hear a lot of farmer deaths also, thus affecting the food availability and access in many ways. And thereby there is a lot of stress among the farmers and also among the consumers because the food prices are getting hiked. And the changes in the temperature or unstable moist weather condition could result in the grain being harvested with more than 12 to 14% moisture required for stable storage. Absence of drying facilities will result in higher crop losses due to contamination with microorganisms. So storage costs will increase, resulting in rise in the food prices. So you must have heard of the Sargent system. Sargent system, like as the image is shown, Sargent system is a very good system of agricultural adaptation, wherein you can plant the crops accordingly and grow. And you have to raise the irrigation efficiency and expand the drip irrigation, improve rain-fed farming, shift the cropping patterns and the crops, lift the nutritional value, elevate the nutritional value of the crops, expand the urban farming, promote the Sargent system, that as well. And we can improve the crops for the drought resistance crop can be improved, and study the land suitability. You choose the crops accordingly and select the best crop for the suitable land. Crop rotation can be done and mixed crops can be planted, as I shown in the previous image also, rice, maize, like that. Support soil and water conservation, rise the ground in low areas, plant shorter rotation crops. This is how you can adapt, like adaptable varieties in water, more resistance in water. You can plant crops more resistance to water in areas where there is more flooding. And in areas where there is more drought, you have to plant more suitable crops, which will grow in a drought condition. And for the land area which is more prone for flooding, you change the profession itself. Like from cropping, you can go on to do fish ponds, and then you can relocate from the place where there is flooding zone. You go to the mountainous zone. So what happens on the climate change on food? So it is putting food safety at risk, and action is needed to prepare the food system for the challenges again. So climate change is threatening the safety of food sourced from both land and also the sea. Both is getting worst affected. And what happens is the impact on the food through both chemical, like heavy metals. When you eat bigger fish, there is a lot of metal in it, heavy metal, especially mercury in it, and pesticides, mycotoxins, and then algal biotoxins. So all this is becoming more common because of the climate change. So climate change is also expected to lower the nutritional value in the staple foods. So in seashores, the most common staple food will be the fish. So it will lower the nutritional value by reducing their levels of macro and micronutrients. And so what happens? The combination of malnutrition, already malnutrition is prevalent in India. It reduces the immunity and increases the susceptibility to foodborne pathogen. And added to that, higher risk of exposure to food hazards under the climate change. And so it gives rise to dire consequences that will require urgent international attention. So unsafe food is detrimental to people's health and food security, and creates loss of livelihoods, national economies, and international trade. So global hunger, we have improved. India has improved a lot, but still we are striving to come up and say that we are free from hunger. So climate variability and extreme weather events, they are the key drivers behind uptick in the global hunger. The World Bank estimates that climate change can push 62 million South Asians into poverty by 2030, and risk of hunger and malnutrition could increase up to 20% on an average. Annually, 200 to 300 million people are affected, and 26 million people are forced into poverty due to climate-related extreme events. It is said by World Food Program. So climate change, water and food supplies, they are the drivers of instability actually. So apart from that, poverty, ethnic polarization, and poor governance, climate change, water and food supplies also are the drivers of instability. This is what United Nations says. So scarce resources are rarely the sole driver of violent conflicts. There happens to be violent conflicts, and water supply and food supply are the recruitment tools during the conflict. What they do is they say that we will provide you with food. You come and join this terrorist group. So this kind of thing is happening. So water and food supplies as a recruitment tool during conflict is being used, and it can be used as weapons of war also. And now there is COVID-19 everywhere, and slowly it is reducing, but still that has also created a lot of problems in the food security. So food production has substantially increased globally, and there is enough surplus food stock at the aggregate level to feed everyone. And in the last 40 to 50 years, India has become self-sufficient in food production with 291 million tons of cereals, with some 75 to 80 million tons in the food stock. Already we have that. And yet 690 million people are estimated not to get enough food to eat globally. Over half of this population are in Asia, and the largest numbers are in India. This is alarming actually. And how can we disrupt this vicious ecosystem as individuals? So what we can do is we can share our meals. That is what at the best we can do. The first thing is we can share our meals. And community level grain banks, it is their prevalent since the beginning of a very old tradition of community level grain banks. It is more prevalent in South Asia. And promoting growing millets, which are not only nutritious, but also climate resilient. And plant more trees and grow your own nutri gardens in your space. Even if it's a small balcony or a terrace or a garden, you can grow your own garden. Encourage your community also to do so. When you go for community posting, you can encourage your community also to do so. And also being mindful of where and when your source, your food items are from. Where is it coming from? The further and longer the food item has traveled to reach your plate, the more carbon footprint it has. So it is better that you eat local and eat seasonal food and encourage everyone to do so. So climate change is there to stay. We can't do anything about it. So it will continue to affect the agriculture, livelihood, and food security. And the poor and the vulnerable will be the impacted one, most impacted one. So therefore, it is very crucial on the part of planning, policy, and program work in agriculture, food security, and livelihood. Not only it is the government's job, it is also our responsibility to plant more trees, and then avoiding plastic consumption, and then buying from the local vendors, and preparedness, early warning, adaptation, food diversifications, and resilience building are the key in agriculture and livelihood sectors development and scientific research and planning. Thanks a lot for this opportunity. These are the references. Thank you for the patient listening. I hope I completed on time. Thank
you. So once again, thank you so much, ma'am, for such enlightening words. And really, you have emphasized about the problems which are happening with food and water supply because of all these climate changes. Yes, we complain every day, and it's the beginning of summer season. It's April beginning, and we are complaining every day whenever we are in conversation that this year the heat is extreme and what will happen during the month of June, July. So every year we are doing so, and all these are changes because of the climate changes. And yes, we are also contributors into it. And it is affecting our food and water supply. And some of the prominent changes which you have enlisted are growing deserts and increase in magnitudes of floods and droughts. And of course, along with that, we are facing food shortage, then inflation, as well as water scarcity. So these problems are continuing to stay with us. But of course, there are ideas which you have clearly illustrated, which we can incorporate in our day-to-day life, even at our individual level, to contribute at least something for these climate changes and of course, toward the humanity. So thank you once again, ma'am. And now we will move to the next speaker. So the next session is climate changes and its impact on disease profile. Speaker is Dr. Sushma Saini from 9 PGIMR Chandigarh. But because of some urgent commitment, ma'am will not be able to join us. But that's very generous on her part. She has recorded a video and sent that video session with us. So we are going to play that video, and the topic is climate changes, how it is affecting the disease profile. And just to talk about Sushma ma'am, actually she doesn't require any introduction, but once again, just a few points which are highlighting one. She is also MSc Community Health Nursing, and she has completed PhD from Punjab University, Chandigarh, and has got 24 years of teaching experience. She is member of 13 national scientific bodies, joint editor of nursing and midwifery research journals, and member of editorial board of many reputed journals. She has presented multiple papers and invited guest faculty at national as well as international platforms, has got 80 publications in reputed journals, and is the author of many chapters in various books. She has got special interest in reproductive and child health, and she is guide for PhD students who are enrolled under INC Consortium and PGIMER Chandigarh. And she's also currently project director of Composite Target Intervention Project run by Indian Public Health Association in collaboration with State AIDS Control Society. So that's we are very grateful to have ma'am's recorded video with us. So can we play the video, please?
Good morning, everyone. First of all, I would like to thank organizers for giving me this opportunity to speak in front of all of you. Today's topic for discussion is climate change and its impact on disease profile. And we know that the climate change has an impact because our health is climate sensitive, and there are indirect and direct effects of climate on our health. Direct means injuries, disability, drowning, or heat stress. Indirect, which are due to heat or the change in the climate, heat, flood, and all. This may be water and foodborne diseases, malnutrition, vector-borne diseases, air pollution, allergies, or the psychological stress. Before discussing further about the impact of climate, let us understand our climate. In our climate, we have sun, then the atmosphere of Earth. Atmosphere Earth is of cryosphere, which has ice and snow, land, rock, oceans, volcanoes, and atmosphere chemistry. So all this make our atmosphere. And this atmosphere, as per the natural greenhouse effect which occurs on the earth, that is the energy or the heat comes from the sun, and it is redirected, and less re-emitting of heat is there and more heat is escape into the space. But due to the human and hence greenhouse effect, what is being observed is that with the rising amount of carbon dioxide in the atmosphere, what is happening, this all the house gases like carbon dioxide, methane, nitrogen peroxide. So what is happening, that heat which reaches to the earth from the sun, it very less amount of it is escapes into the space. The rest of it traps into the earth and it makes the earth warm. So this picture will make it more clear, like the greenhouse gases, they trap energy into the atmosphere of earth, and which make the atmosphere very warm. And this warm atmosphere, this further leads to warmer oceans, more evaporations, changing conditions for the planets and animals, melting snow ice, and this further leads to stronger storms, more participation, more precipitation in some places, more drought and wildfires, changing seasonal patterns, shifting ranges from the migration, habitat loss or extinction, and rising temperature. So all these things we are finding, this is happening because of greenhouse effects and warm atmosphere. And if we look at further, there are four things which are causing the health problems due to climate change. That is more extreme weathers, rising temperatures, increasing levels of carbon dioxide, and rising sea levels. These four climatic changes, they give rise to severe weather, air pollution, changing in vector ecology, increasing allergens, water quality impacts, food and water supply impacts, environmental degeneration, and extreme heat and extreme weathers. And they further give rise to many diseases such as asthma, cardiovascular diseases, and then some vector-borne diseases like malaria, encephalitis, Rift Valley fever, Lyme disease, because even the places where these diseases have been extinct due to the change in temperature, this mosquitoes are the breeding of mosquitoes restarts, and these all diseases, they come up in those areas. Apart from that, respiratory allergies and asthma due to air pollution, and cholera, cryptospirosis, that is due to water quality impacts, and food supply impacts give rise to malnutrition, diarrheal diseases, environmental degenerations. They force people to migrate. There are civil conflicts and mental health impacts. And the extreme heats, they give rise to heat related illness and death, cardiovascular failures, and the severe weathers, fatalities, and mental health impacts. So these are all impact of climate change to the human health. And this climate change make the whole human very vulnerable, or the human population very vulnerable, and expose them to the extreme conditions, and then the diseases which occur as a result of exposing the population to the extreme situations. The health system capacity, they may not be able to meet um, all those conditions. And these vulnerable factors which are making people exposed to many diseases are their demographic factors, geographic factors, biological factors, and socio-political impacts and socio-economic impact. And all this give rise to climate sensitive health risk, and which further give rise to the injuries, heat related illnesses, respiratory illnesses, waterborne, zoonotic diseases, vector-borne diseases, malnutrition, non-communicable diseases, and mental stress. So these are all due to the impact of climate change. So let us discuss one by one. Climate change and health means, first of all, let us take the extreme weather event. When the weather increases either very hot or very cold. So in case of very hot weather, the food safety, nutrition, and its distribution, they all hampers, because there is an interaction of rising carbon dioxide and climatic change, and they impact on the food safety and nutrition. The temperature and the precipitation of extreme, that if the temperature is high, it gives rise to flooding. And this flooding, they further increase the pathogenic load, which make the food exposed to the microbes. And rising carbon dioxide, they can directly influence the nutritional content of the food. And the warmer temperature, they can result into greater food spoilage. The food gets spoiled very easily, and extreme climate events, they can disrupt the food distribution. And the direct impact which happens to health due to heat, the human body, it maintains body temperature in the ambient temperature, which not exceed 32 degrees centigrade. If it exceeds to that, the person becomes very unrest is created and very uncomfortable. Above this temperature, heat loss through skin and sweating. Heat related illness occurs when the body enables to adequately cool down, and minimum ambient temperature is also important. There is difficulty in cooling when the minimum temperature is greater than 22 degrees centigrade. High humidity reduces effectiveness of sweating and increases the risk of heat related illnesses at a given temperature. And this increased temperature, they give rise to heat cramps that further give this muscular pain and spasms. Heat exhaustion, that is body fluids are lost through heavy sweating. Heat stroke, that may be life threatening. And indirect impacts are a range of areas that can be potentially be affected with gradual and extreme temperature increases. This includes impact on ecosystem, water, food, disease carrying vectors, lifestyles, and human resilience. But how to cope with this and stay safe in the extreme heat? You can stay healthy in this heat by drinking plenty of water, never leaving anyone in the car, staying somewhere cool, planning ahead, and checking on the others. And these are few more impacts we can see, which we have discussed earlier also, that the problems are there due to extreme heat, outdoor air quality, which give rise to air pollution with the coming of so many vehicles and factories, which they are continuous emitting the pollution in the air. And then flooding, maybe due to the extreme weather, rising sea level, then vector-borne diseases because the changes in the temperatures are there. Water-related infection, that is also due to rising surface flooding and other causes, they give rise to water-related infection. Food-related infection are related to increase in temperature and humidity. And mental health and well-being is again directly concerned or indirectly concerned with the climatic change that impact that is especially during the extreme weathers. And who is most at risk of health effects due to this climate change? There is some population which is more vulnerable as compared to others. For example, children. And children, they are vulnerable because of their several characteristics such as they're more susceptible to heat stress and dehydration, and they're sensitive to exposure to air pollution and smoke and bushfires. And other their immune systems are not fully developed, which putting them at increased risk of infection. They often need to rely on adults to keep them safe during emergencies and help them to recover afterwards. Pregnant women, they are at risk of heat stress during the heat waves because their physiological demands of pregnancy, and they and their unborn babies are particularly sensitive to the exposure to air pollution, smokes, and bushfires. Older people are the another group where, because of the pre-existing medical condition, they are more prone to dehydration, heat stress, infections, exacerbation of heart and lung diseases. And the people living in the rural and remote areas, people on low income and other vulnerable population, they are also at increased risk. And in part because due to inequalities of underlying health outcomes and limited accessibility to healthcare and other services. People living in rural or remote communities or who are living at cost, and they are also at risk from extreme events such as bushfires, drought, storm, and sea level rises. And then the another problem which comes due to climate changes, that is floods. And floods, we know that how much havoc the flood creates. There is immediate deaths and injuries. There are non-specific increase in mortalities, isn't it? The mortality of human, animals, and there are infectious diseases such as leptospirosis, hepatitis, diarrheal diseases, respiratory and vector-borne diseases, exposure to toxic substances, mental health effects because of so much of loss due to flood and the loss of the deer and near and the property and economics. There are indirect effects of the flood which make the person very stressful and increased demand of health system because many people become sick at a short interval due to flood and the health system may be overburdened with that. Then drinking water supply, that the climate change also affect the drinking water supply. Dry climate causes changes into the land cover and runaway patterns, and increasing bushfire risk, increasing sediment, nutrients, and debris. Flooding can also affect drinking water supplies and due to the coastal intrusions and contamination. Then there is a reduction in the flow of dams and groundwater aquifers, increased evaporation from surface water storage, salt water intrusions into coastal aquifers, acidification and susceptible inland aquifers, increased risk from the concentration of nutrient and chemical contaminants, and formation of toxic algae or bloom. Then the third is the air quality, because the climate change also can cause the air pollution, and the visibility can be reduced. And so this is the major role in the development of the transport, dispersion, and disposition of air pollutants. And the air pollutant episodes are often associated with stationary or slowly moving air masses. And the air pollution and fine particles, particulate matters, they may change in response to the climate change. And then you can see this kind of situation of air quality. You can see that how hazy, and we cannot, the visibility is so low. And airflow on the edges of high pressure system can transport ozone precursors. Ozone levels are increasing in many areas, and an increase in fire events will mean increased toxic gases and particulates. Changes in wind pattern may increase long range transports of air pollutants. Weather patterns can enhance urban heat islands, which can lead to elevated pollution levels. Transportation emission, industrial waste, they all give rise to air pollution, and they may hamper the quality of air. Then there are another potential health impact of air pollution, that is due to ozone, pneumonia, COPD, asthma, allergic rhinitis, and others, premature mortality, particulate matter known to affect morbidity and mortality, toxic gases from fires contribute to acute and chronic respiratory illness. Evidence from the Indonesia fire, which has given rise to a lot of toxic gases in 1997 into the air. So that is an example. And wind-blown dust, that includes respirable particles, trace elements, they can be blown with the wind from the desert region and can affect the population in remote areas. And evidence has shown that the mortality has increased in the days after the dust storms. Then the climate also impact on the water related illness, because this is increasing frequency and intensity of precipitation, and that give rise to floods, and there is a what you say, farm and livestock runoff, and there is a the nutrient and contaminant loading, even the groundwater get contaminated, and so all these things, they give rise to water related illness. Then another problem due to environmental or climatic change is the mosquito borne or the vector borne diseases. And so this is because of rising temperature, changing rainfall, and increase that may be increase in rainfall or decrease in rainfall, or the seasonal changes, the cyclones, flooding, changing in the animal host, reservoir population, rising sea levels, extreme tides, loss of coastal margin. So all this give rise to this increase the mosquito breeding, and with that the mosquito borne diseases. The human factor for the mosquito borne diseases is location of population, that is geographical location and proximity to water bodies, urban environment, that is peri-domestic breeding, mobility of population, arrival of infected people, international, interstate, intrastate, so there can be mobility to any of these places. Living standards, that is the insect screens, air conditioning, social and political breakdown. So all these things are responsible for the mosquito borne diseases. And then the breeding is also influenced by the water hoarding or the storage, rainwater tanks, uncovered containers, dams, irrigation, groundwater recharge. So all these are responsible for mosquito breeding. Then the another problems come due to climatic changes, food production. So that is the land-based land. If you talk of land, so land-based agriculture, the food production, loss of soil fertility, erosion, and salinization. So they change in the crop yield, the effect on the feed intake and animal reproduction, changes in the pest, weeds, and diseases, changes to use agrochemicals, and then there are dietary and nutritional changes. The fisheries, it also has the effect on fisheries, ocean and the coastal fisheries. A change in coastal circulation pattern that can affect nutrient supplies, lagoon flushing, coastal erosions, this ocean acidity and coral bleaching, and decline in the productivity of this fish. Then there are social impacts. The lifestyle and behavior are likely to be affected in following ways, because due to increased temperature, increase in crime, particularly evolving aggression, accident, that is workplace, that could be at workplace or it could be a traffic accident, decline in physical health. Hot nights may cause sleep deprivation, recreational opportunity changes, changes to exercise pattern, changes in alcohol consumption, stress, lack of cold water, reduced ability to cool down. So all these things help on the lifestyle. They have impact on the lifestyle and behavior. The mental health can be impacted because of anxiety and depression, post-traumatic stress disorder, insecurity, grief, stress, self-harm and possible suicide, drug and alcohol misuse, impact of the individual and communities, loss of social cohesions, dislocation, specific impact on the children, women and elderly. The economic impact may follow, that is loss of income or asset, reduction in the goods and services, higher cost of insurance, food, water, energy, financial strain and government for the government and others, impact on the provision of health services. And mental health and well-being, if we look at there are problem due to climate change, the medical and physical health changes in the fitness and activity level, heat related illness, allergens, increased exposure to waterborne and vector-borne diseases. And then mental health are caused due to stress, anxiety, depression, grief, sense of loss, strains, and social responsibility, substance abuse, post-traumatic stress disorders. Then it also has impact on the community health, that is increased interpersonal aggression, increased violence and crime, increased social instability, decreased community cohesion. And the population concern, that is the determinants of vulnerability of the population are that how much they are exposed, what is their exposure, a contact between the person and one or more biological, psychosocial, chemical, physical stressors, including stressors affected by climatic change. Then sensitivity, that is the degree to which the people or communities are affected either adversely or beneficially by climatic variability or change. Or the adaptive capacity, that is the ability of communities, institutions or people to adjust to the potential hazard or to take advantage of opportunities or to respond to consequences. And this vulnerability is of the human health is due to climate change, and which can have the impact on the health as injuries, acute and chronic illness, mental health problems, development issues, and even death. And so ultimately the health consequences of air pollutions are like this: pollution can harm to any part of our body, it may be brain, lungs, heart or eyes. And the population that is vulnerable to these health consequences of air pollution, that is age group, the children, pregnant women, predisposal health and medical conditions, the people who are having the already they are suffering with the pre-existing medical condition, low socioeconomic condition, or the occupational group. These may be traffic policemen, traffic volunteers, constructive workers, road sweepers, rickshaw pullers. So all these people can be affected. So key factor in the climate change, it's not only a problem for the future generation, it is already happening or it has already happened. Higher mean temperature is recorded each year, and many people are being affected by disaster, climate sensitive diseases and other health conditions. Climate changes, they exacerbates some existing health threats and creates new public health challenges worldwide, only considering a few health indicators. Additionally, 2.5 lakh deaths per year will occur in the next decade as a result of climatic change. And health sector has an important role to play in reducing greenhouse effect emission, and which is the major cause of climatic change. And investment to greening health care facilities, such as the use of solar panels, energy efficient equipment, and waste management, which must be prepared accordingly. Globally, only 0.5% of multilateral climate finances have been attributed to health projects, and healthcare facility also need to be safe and remain operational during and soon after the disaster. And there are certain tips and actions which we can take to reduce the contribution of climatic change, like maximum time walk or cycle, drink tap water, eat fruit, vegetables, and whole grains, reduce processed and packed foods. So that can make you healthy. Thank you very much.
Thank you so much, ma'am. And although ma'am was not able to join us even virtually, she had another commitment, but still it never felt like that it is a recorded session and very lively presentation and very elaborate one. And of course, ma'am has covered not only the physical health, but even touched the aspects of mental and social health. And of course, certain tips which we can do at our own level. So once again, thank you so much, ma'am, for this recorded version. And some of the prominent key facts of ma'am's presentations were like crowding, inadequate sanitation, extreme weather events. All these are the direct changes which are being caused by the climate interruptions, and the diseases which we need to really concerned about are like increased respiratory and cardiovascular diseases, injuries, premature death, and also the changes in prevalence and geographic distribution of food and waterborne diseases. So challenges are so many in front of us if we talk about our health. Now, going toward the next session, it's about climate changes and its impact on health. And speaker is Professor K. Punita Lakshmi, Professor, JIET College of Nursing, Jodhpur. And since this COVID-19 pandemic, there is growing attention toward mental health. And yes, we need to be very happy about it, because actually now this phenomena is getting global attention, and especially at our country level. Everybody is now concerned about mental health too. And here also climate change is affecting our mental health. And of course, it's not that it is hearsay. There is growing evidence also that there is link between certain air pollutants and mental illnesses like depression, anxiety, and suicide. So let's listen more about this impact on mental health from our expert. So Dr. Punita Lakshmi. She is a MSc in obstetrical and gynecological nursing. Since 1997, she has been working in various capacities like staff nurse, junior nursing tutors, and upgraded herself as principal from year 2003. She also worked as a lecturer in Department of Midwifery, College of Health Sciences, Deborah Tabor University, Ethiopia. And during that period, she has been a chairperson for national conferences, member of Curriculum Revising Committee, examiner of National Level Qualification Examination, and member of Problem-Based Learning Training. She has published many research papers in national and international journals and conducted and attended more than 100 conferences, seminars, and workshops. Life member of various professional associations and society, and in her credit, she was awarded with Glory of Education Excellence Award in 2015, and also she was the first woman to get facilitated by Women's Excellence Award by JIET Group of Institutions. So we are very much honored to have such an eminent guest speaker with us, and along with that, she is very humble. Because since last few days we've been conversating and very humble and very polite. So over to Professor K. Punita Lakshmi ma'am. Punita Lakshmi ma'am, are you there?
Can you hear me, ma'am?
Yeah, ma'am. Yes, you are audible.
Yeah.
And you can start your screen sharing.
Yes, ma'am. Sure.
Thank you, ma'am.
Yes. Can you, ma'am, can you, Manpreet, ma'am?
Yeah, ma'am. Yes, we can view the slide.
Yeah, you can.
If you can also put on your video, I think that will be more lively.
Yeah, it was just I'm trying with. Let me. Somewhere, because of the technical thing, all of a sudden. Yeah, I'm just trying with a video. Just let me get into it, ma'am.
Sure,
Why
sure.
don't we start with?
Yes, ma'am, you can start.
May I? Yeah. Okay. Now my video is there, ma'am. Is it there?
No, ma'am. Actually, we can't see you. But otherwise, your slides are visible. You can start, ma'am. No problem.
Yeah. Then I'll go with the slides only.
Sure.
Yes. Good afternoon to all, and sorry for the inconvenience with the technology which has happened. And first of all, I would like to say my hearty thanks to the principal of Shri Guru Ramdas College of Nursing and to Dr. Manpreet Kaur, who has been with me for from the beginning until date. Thank you so much, ma'am, and good afternoon to all the participants and the dignitaries and the co-speakers of today. And going with the slide. Yeah. Actually, what is our planet, our health, climate change, and the mental health is the topic for me. Today, our planet and our world are experiencing best of times and the worst of times. Both the things we are having hand in hand. The world is experiencing unprecedented prosperity, which is unexpected, while the planet is under the unprecedented stress also. Human health risks from global environmental change demand a concentrated effect among the nations of the world to redress the causes of climate change, land uses change, and biodiversity loss. So on this, if you go ahead, the climate change and the health, when we take, especially with the mental health, the climate drivers increased temperature, precipitation extremes, because Sushma Saini ma'am have made my work very easier. All these concepts have been dealt with by Sushma Saini ma'am. So I'm just moving on to the next slide. Just here, I would like to make it as 6 components of climate psychiatry. So one is slow moving disasters, which we can call the climate change and the disaster hand in hand. Extreme heat effects, acute climate disasters, eco-distress syndromes, vulnerable populations who are getting affected very badly with this, and the action what we can go. On seeing these things, just we'll go on with the first component. How does climate change impact mental health? Slow-moving disasters, number one is land loss, drought, air pollution, all these things causes it. So the drought, when the farmers lose it, what is their mindset? Because that is their life. Okay, when they are not able to do it, what they are going to make up and how their mindset. So this is one of the things. They'll go for anxiety. Not only the single farmer, the whole family, the group, the community, everybody is going to get affected with that. So under that impact, psychological impact, anxiety, depression, hopelessness, when livelihood threatens, especially among the developing world farmers and the farm workers in the developed country. So here directly we are doing it there. The farm workers are affected in the developed countries. So next one is displacement, because once you don't have a proper living opportunities, the farm is gone and no mean of life, you have to move on. So displacement occurs. You're forced to migrate to some other places. Increased urbanization and intercity poverty also occurs. So this again, if you see with the political instability, so the farmers, what they will get, the loans and other things, how much of the tax, whether the tax waiving is there, or all these things will be causing them into a great tension and discomfort. Here comes a special word of solastalgia. It is like a psychological distress and the grieving from ecological degradation. So here solastalgia means it is nothing but they are living with the comfort with pain. Okay, they are with the pain with comfort. They are living in the family, but they are having that loneliness, that homesick at home. So this is what we can say, this sort of life goes on with that. And if you go with the other things of drought, when we see the statistical report, Andhra Pradesh, Bihar, Gujarat, Jharkhand, Karnataka, Maharashtra, and part of Northeast, Rajasthan, Tamil Nadu, Telangana, they are the worst hitting places. These states are home to 500 million people. That is almost 40% of the our Indian population. So this is one of the things, drought occurs, which gives the effect. So psychological effect is becoming this much of impact towards the people, those who are affected with the drought, and this is the scenario with us. Then coming to the air pollution. Okay, air pollution is one of the things, that is the carbon dioxide emission. We all know, even in Delhi, most of the time, because of this air pollution, the schools are closed, colleges are closed, people are not able to move out freely. So this is the thing. When we see to the world's statistics, we stand in the third place of carbon dioxide emission. So it is going to lead in 2020, we can see it as 412.5 parts per million in 2020 is the research says on. And next, if you go to the sea level, because here where most people are affected by rising sea level, because the sea level is getting away, we can see in this picture, India, the darkest maroon color is indicated, it is 10 to 50 million. Okay. Then this is assuming a rise in sea levels of 50 to 70 centimeter, that is 2 degrees centimeter temperature increases. So when it is coming, the level of water goes off and the sea level is coming rise, and there is again the lack is there. So on this is the slow disaster. When you come to the second part of the component, it is extreme heat effect. So what is that extreme heat effect? Because ma'am have already dealt when extreme heat effect, what are the disease conditions? Here, what will be the mindset of the people? That we have to look into it. the mindset of the people, because even now in Rajasthan, we are living in Jodhpur, this is a sun city. Last year at this time, the temperature was 35 degrees Celsius. And now in the beginning of April, we are facing with 43 degrees centigrade. And as Dr. Rajeshwari ma'am said, they are not, till March, they were used to wear sweaters previously. Now there is no need. So here we can come to know how much the global warming is occurring. The extreme heat is going on in this world because of our fault. It is none other. It is we who have created this. So under this, if you see with the heat and acute disaster and a precondition for subsequent disasters, mental and behavioral impact. Number one is increases in interpersonal and group violence. Okay, we'll see why it is. Okay, then the thing is increases in suicide, impaired cognition and concentration also, impaired sleep, psychotropic and other medications, impaired temperature, homeostasis. So this all occurs when the heat is production. Why it is there? Because if you see violence, we are talking. Violence is one of the cause due to the serotonin, which is the neurochemical which is present in the brain, which is a transmitter to the neurons. When this decreases, because it is one of the cooling effect of our own internal body, that is the action of serotonin. Okay, so when this is going to decrease, automatically your aggression which comes out. So aggression which leads to violence also. So this occurs with these things. So this tunes our internal heat system, the serotonin, and when it occurs, the violence comes out. You can see with the things with the 85 degree Fahrenheit, they were saying compared to the days below the threshold. So they write, moreover, they find that heat only affects violent crimes while property crimes are not affected by higher, because property crimes are always, this heat itself will cause the crimes. That is the dangerous one in the world. So again, what the heat is going to do? Heat is going to cause suicide also. The suicide is again one of the things which they cannot tolerate. They go beyond. They are not able to cope up. So when their incapability comes, the suicidal tendency acts upon. So the next thing is as ma'am said, it's urban heat island effect. So why? How the heat goes on? Nowadays, what is the funny thing? What we have destroyed all the agricultural land. We have constructed the buildings, very big buildings. Now we are planning with the roof gardens. Okay, so that roof garden is a famous one now. But that is also good because we have to grow greeneries. So on that basis, if you see this picture, in the rural areas, the heat absorption and retention is very low. In city, it is very high because we don't have adequate water consumption or plants are available. So this is one of the things we have to look into it. Next, the thing is impacts of extreme heat. So we have seen what is going to happen here. Insomnia, first sleeplessness, because both garmi hai. What is the thing? Immediately we want to on the AC wherever we go. Even if we go out, immediately we want to enter into some shopping malls so that AC is there. So we are used up with that thing. We wanted to cool ourselves. If not, we cannot. If the electricity, the power goes on, we can't sleep. Then you think over the extreme temperature, what the global is facing. So automatically, this is the main problem we will be having it. And next is disturbs mental and cognitive functioning. Okay, this is again, which is a knowledge oriented, where you cannot, you say, my God, I can't cope up with, I can't do the work. I'm just facing difficulty. So all these things comes over in your cognitive functioning. And this executive functioning. When you see with the executive functioning, it is a range of both cognitive behavior and emotional difficulties, which often occur as a result of another disorder or a traumatic brain injury. So this is another one. So distress. So this is the major thing, what you feel it of. Then the thing is exacerbation of psychiatric disorder. That is especially a bipolar disorder gets into. A person can develop bipolar disorder. We know what it is. One time they will be very happy to talk, and the same person will be depressed and they will show their anger towards you. So this occurs because of this extreme heat. Next one is worse with urban heat island effects. What we have already seen, the same thing comes out. Even in the village sector, if you go, it is greenery. You can go and sit under the trees. But in urban, it is not possible. We have to depend on the ACs and other electronic appliances. So this is one another thing where there is extreme heat. The next slide shows acute climate disaster. Immediately, because we didn't predict at all. We didn't predict. But immediately it has crushed us or it has attacked us. So that is sort of things. In that cases, flood is one of the what we can say is one of the dangerous one thing, and which is not able to accepted by us because we lose many people. Flood, cyclone, tsunami. When tsunami came, everything was vanished. The many villages have gone into the water and nobody was there, and n number of deaths occurred. So even today, which has happened, tsunami which has occurred in 2004 in Tamil Nadu, the children, those who were affected in that tsunami, even now they are having that impact of loneliness, and they often feel they are having it in their mind. So it carries on, it cannot be controlled, but certain things we can do it. So if you see in Assam, since 1947, more than 1.25 lakh families have lost their agricultural land and residential land due to this flood only. So this is one of the cause which is acute. Next is the forest fire in India. When ma'am was talking about, Rajeshwari ma'am, she was talking about the wildfire. So in this, if you see, India reported around about 3,45,989 forest fires from November 2020 to June 2021. This is one of the record of SOFR 2021. This is released recently only in January. They have released. This is the highest recorded in the countries for this period so far. So what happens? Again, the air pollution, loss of land. So everything comes under. We are losing the greenery of the world. So this is the problem. And what will be the psychological effect if it is there? The disaster has occurred immediately. The psychological and behavioral responses to disaster will be distress responses, high-risk behaviors, and psychiatric disorder. Number one is distress response is change in sleep, decreased sense of safety, irritability, distraction, isolation, avoidance. So these things will be there in the distress immediately where you are in such a great loss. So next, high risk is because of this you want to come out sometime, you are affected but you wanted to come out. The high risk behavior you will take is not a good behavior. Another thing is like smoking, getting into alcohol, over dedication, that the person who wanted to forget or don't want to go to that particular place will try to work for more time and they dedicate themselves for something else. So that over dedication will be there. Change in travel, they don't want to be there in the place. They will move on because of the memory which they are getting again and again, and the grief, what the word we can say is grief, they carry on. Separation and anxiety here. Next is the psychiatric disorder. We can say it as anxiety, PTSD, that is post-traumatic stress disorder, depression, and complex grief. Okay, everything becomes a multiple thing and what it is occurring. This is the thing. And next, if you come to post-disaster, that is immediately you wanted to get rid of it. And here the grief responses due to losses, because they have lost their life of people, and the homes they have lost, pets they have lost, property has gone, no financial stability, and the whole community has been vanished. So here the grief is the most important problem they face with the things. And the exacerbation of mental illness. Okay, it scratches again and again, and substance abuse they go on with. New onset of depression, anxiety syndrome. Again, post-trauma will be there occurring when we say unrelatively, it is inflexible. They are not flexible, it is inflexible. And survivor of guilt. Sometimes we may feel guilt that I would have gone with them, or why this has happened. All these questions comes inside them. So that is one another thing. So displacement, again, they become a refugees. You can see now also from Ceylon to Tamil Nadu, people are coming for the problem of they cannot live over in one's country, and they go to some other country, from one state to some other state for their life. So they're the displacement. Once they become the refugees, they lost everything, and here they have to make their new survival. So that is another thing. Then community fragmentation. This is absence of connection. They don't have the connection with the whole community. One person gets scattered somewhere. Isolation, they are isolated. So this is again a painful thing. Vulnerable group impacts. When regarding the vulnerable groups, ma'am have already said the elderly people, pregnant ladies, children, those who are already not having a home properly and not having a proper income, they are also again affected what they are going to do. So this is another problem. Next is the challenge to the healthcare delivery, because it is not immediately when the disaster comes, thousands and thousands of people are getting affected. Immediately we cannot provide it. It becomes a challenge, but we are doing it as a professionals, and we can say very proudly that India is doing the very best things in all the aspects of healthcare delivery, keeping COVID-19 achievement in our thing, vaccinations. And next we are going to see to the next component. How does climate change impact mental health? This is the eco-distress syndrome. Eco-distress syndrome, that is an extreme anxiety. Distress calls as an extreme anxiety. The simple word is eco-anxiety. Okay, eco-distress syndrome, we are having it over, and we are seeing what are the psychological responses to this. Wide range of emotional reactions, sadness, anger, anxiety, hopelessness. So they feel all these things because everything has gone. The climate has taken away everything. So all these things comes inside their mind. The same thing is the repeated one. One change will cause the thing, and all the changes will be there. Only the thing is, in the disaster, we lose many people, and in other things, we are becoming sick, and then the other things follows on. The new syndrome will be climate grief, climate anxiety, and distress. Again, here, this solastalgia will be there. Then psychological defenses and responses like denial. We are not ready to accept. It results of paralysis. Paralysis is not that they become immovable with the things. They become incapable of making things to be done and avoid of solutions. Apathy, indifference versus heroism. What they were before, they cannot be now. And Mother Nature's calming properties. Okay, how they are going to do it. The nature. So when Sir said, we are doing, our planet is crying. When our chief guest, Dr. Daljit sir, was saying, he mentioned a word, our planet is crying. Who is the planet? Our Mother Nature. It is crying. And who made that to cry? We made it to cry. And whose duty to make the tears wiped off? It is we. We have to do it on. When we come to the awareness of climate crisis, okay, how we will come to know. It is a climate fear and the climate grief. This already we have discussed with, and the same thing here in the slide. So I'm moving on to the next slide, which is very interesting. Okay, this I just gone through a book, what we think about when we try not to think about global warming. So this book says it is used as a psychological defenses and are used to manage eco-distress. So we'll go. Number one is distance. Okay, the distance, the base is, this is like a marriage cake if you see. And it is called, first one is the distance. We keep distance. We think, okay, it is for somebody else, why we should. That comes to the mind and we keep distance. Number two is doom. We know something is going to happen, but still we are not ready to do anything for that. That is doom. The next thing is resonance. It is a lack of harmony between the people. Okay, we are not ready to have the thing accepted. We make an argument, no agreement. So the argument is there, but you're not coming to an agreement in dissonance. And next thing is denial. We are not ready to accept this has happened or this is going to happen and I should be ready. No way. So here we are again lacking this. The last cake piece is identity. This is a climate change has become a political and cultural identity for people accepting it or not accepting it. So here we have our own identity to cause it and to get out of it. So the climate key message is this: where we are, what we have to do to change ourselves. So how we are going to manage? It is very simple. The same thing what we did when we were having this COVID-19 disaster, we can say, okay, it has occurred like that. So how we have managed the same thing here, we are going to do it. Rest yourself. That is sleep. Number one, restore your energy. Don't think too much. Routines, you be following with all the routines, whatever you're doing it, that has to be followed for any purpose. It should not be stopped. Relaxation. Don't do the work continuously, getting exhausted. So in between your work, give a relaxation. Recreation. Make yourself to get acquired with what you can get a happiness of it, and be with the relationships. With your relations, have the recreation also, so that you will take away the resilience. Stress resilience will occur, which will go away. Thus, stress will go away from you when you follow all these R. 6R will get away the SR. The next thing is, how does climate change impact mental health on a vulnerable population? Who are the vulnerable population? Already ma'am have dealt with, and the same determinants of vulnerability ma'am have already dealt. So again, we need not go and do it. So, but the vulnerable groups, how the mindset goes. Again, already the elderly people behaves like a children only. We have to give a more care to them. Here, their sensitivity increases. And these people, when a little bit of exposure also, they get affected. Once they affect physically, totally their mental health get destructed. So they are not able to have an adaptive capacity. So here, exposure will make them very sensitive, and this sensitivity will make them not able to have an adaptivity in the things. So on this basis, if you see who are the people who will do this exactly, those who are already sick, okay, then the elderlies, that's what the picture, you could see it over here. We have made it, the children and these people, homeless. Here they are elderlies, and also they are homeless in the orphanage. We have, I mean, elderly home, old age home, we have taken this picture. So all these things are there. Okay, fine. Now we are coming to the final component. In the final component, we have to work on, I have already said the word, eco-anxiety. Eco-anxiety, it has many words referred to it. Climate change distress, eco-trauma, eco-agnes, ecological grief, anything could be mentioned over. Now, what you're going to do? What is going to be your action? The antidote to anxiety is action. So how you're going to do it? We make it as a 3 components again. Number 1 is individual and family. Second one is community and institution. Third one is political advocacy. That is the common responsibility. So what we are, the individual I, when you join with the family, becomes we. So how we are going to do it? Consumer-based action, we can say, that is diet, take a proper diet, take proper rest, divestment. That is unnecessary. What we were talking about, the investment in the things where already we are going to spoil the community, right? With the challenges. So here you can avoid that sort of investment, and divestment you can take it out on a and give your investment to the greenery projects and other things. Decrease the fossil fuel based travel, increase building efficiency, so that then you can. But what the statistics are saying, COVID-19 connection with severe curtailment of personal lifestyle globally, still only 6% emission reduction this year. So it means we are not doing it in full-fledged. Okay, even when we are at the home during the COVID, we were using the vehicle. That is saying it again, the emissions are coming out. Next is the community, and the community eco restoration. So here join the projects and the renewal projects can be done. So we are giving the thing properly so that the outcome is good, so you're not psychologically affected. Renewable energy, support citizen control energy and grid reform. Home institutions, work where you have leverages. Speak out and write. Use your voice. Talk about the climate change. Take action as a family. Appreciate the nature together. Okay, all these things will be helping you to cope up with the things what we have seen about the management in the previous slides. And now I would like to say with the next slide is totally with finally don't agonize, just organize. So follow the protocols of the government of the nation, work hand in hand with the community, support the new ideas and thoughts. Our biggest impact will be seen when we can work toward political change challenges. So this is the political advocacy, what we can do as a citizen of a country, nation. So on all these things, one thing I would like to say is hope is a sense that the future is not yet returned. So that what we do will help to write. So we have to make the changes. We need not wait for others to do it, and keep your mind free and try to overcome with it. And you have to keep the confidence, whatever has happened, don't deny anything. Acceptance and adaptability makes a person for a better survival in the community. And the last thing of my presentation I would like to say is takeaway message: be compassionate to yourself and to others, and keep your smile always. Thank you.
So thank you so much, ma'am. It was so engaging that I lost track of time. It was such a nice, very relatable examples and nice questions. So thank you once again so much, ma'am. And really, the mental health, which always remains ignored. And I think through this session, each one of us, once again, we will reiterate ourselves toward this impact which is being caused upon mental health. Because whenever we talk about the climate changes and of course the consequences like droughts, earthquakes, and even tsunamis, the diseases are visible, the direct consequences are visible, like houses are lost, livelihood is lost, the lives are lost. But the impact which is going to stay on for lifelong, that is the mental health. So that is going to stay, and yes, we need to really put attention upon improvement of our mental health as well as the patients and the families which we may come across. Now, moving to the last session of today's E-Symposium, we have the next speaker. Can we have the slide, please? So the topic is nurses' role in combating climate changes. And I think now we need to be more interested into it because we are part of health team professionals. And nurses, they can play an important role whenever we talk about prevention of environmental related risk and illnesses by being in continuous touch with community people. And we can also be instrumental in making communication with patients and families, working with our hospital and health systems to reduce emissions and influencing the adaptation of strategies so that we are better prepared as community for the health impact of climate changes. So the speaker for this session is Dr. Uttal Basha Dandargi. He is professor. Sorry, it's a slide. It's wrongly written over here. He is Professor BVVS College of Central Shri College of Nursing, Bagalkot, Karnataka. And he is PhD in nursing from National Consortium under Rajiv Gandhi University of Health Sciences and Indian Nursing Council. He is MSc Community Health Nursing and MBA in Hospital Management. He has got experience of more than 15 years. Since 2004, he has been working in various capacities like assistant lecturer, assistant professor, associate professor, and currently as professor. He has nearly 25 publications in indexed journals and has attended various conferences as a resource person and chairperson. He is a recognized guide for PhD nursing students for Indian Nursing Consortium as well as Rajiv Gandhi University of Health Sciences, Bangalore. He is a certified basic life support trainer and life skill trainer and NSS program officer of institutional NSS unit since last 10 years. And we are really honored to have Sir with us. I have listened to him physically also, a very effective speaker. So over to you, sir.
Ma'am, can I share the slides from here?
Sure, sir, sure. Yes, now you can do that. And if you can share your, you can put on your video also.
Are slides visible, ma'am?
Yeah, sir, they are visible. Yes, now we can see you also. Okay. Thank you.
Okay, thank you, ma'am. Thank you, Manpreet ma'am, for such a good introduction of mine. And first of all, I think everyone must be hungry by now. I'll not take much time. The nurse's role in combating climate change. WHO has given the theme, it has done its work. And you can see what I need to talk, it's already on the way. Such a program, organization of such a program itself is the first step of nurse's role in combating climate changes. It is a basic step, and I congratulate the organizing team of Sri Guru Ramdas College of Nursing for organizing such a good program and giving me opportunity for this. The first question which comes in mind when we see nurses for combating climate change, is it my responsibility? Being a nurse, my service is to give a comprehensive care to people, either for in health aspect. And how come is controlling climate change or preventing it is my responsibility? And the second question would be, how come are we responsible in handling this situation? The present situation is not because of us. And why are we held responsible for preventing or controlling this situation? And moreover, in India especially, what we think is, this is governments or NGOs or any international agencies' work. How come it is our work? What can I do for this? I request all of you, whatever I talk for, I don't have prepared much content because the talk will be of just 20 minutes. So take it to you personally, rather than putting it on a whole group. Personally, what I can do in this. Moreover, what we can do, why nurses we can do. So let us see what are answers for this. How can we involve in these aspects? So first, let us see what is our strength. The first strength is the most proudful thing. Nurses are the most trusted professionals, are believed to be most trusted because people believe nurses when they speak, as per a survey conducted by Gallup Poll. And according to a British survey, nurses are most trusted professionals in whole world. So, compared to other health disciplines, ours is the only profession where communication skills are taught. We are taught how to deal with the patients, how to talk with others. The social skills are taught. We have a subject of sociology, which we don't see in other health disciplines. So our base is made strong with the skill, with the power of communication. So that's why we are in a position that we should be proud that we are most trusted professionals compared even to army professionals, doctors. Nurses are trusted more. And what is our strength? There are total 27 million nurses working all over the world. It makes almost 50% of the total health workforce. 50%, even it's not the count of nursing students. Then it could be more and more larger. And according to the National Health Workforce Survey of India of 2021, out of 5.67 million health workers in India, 2.30 million are nurses. Again, I'm saying the student nurses are not taken into count. Only nurses have been taken. And you can imagine what is our strength. 45% of the health workers in India are nurses only. So in quantity as well as in quality, we are in a better position to serve this cause. So that's why we, or I personally as a nurse, can involve in this. Now, some of the examples how nurses have contributed for this climate change. Dr. Laura Enderko is a registered nurse, and she is since 20 years she has been working on this cause, and she has been recently awarded. I don't say recently, a few years back, the latest award she received was Champion of Change for her advocacy efforts in climate change and public health. She is a registered nurse, and since 20 years, her work is she is putting all her efforts in preventing this climate change and working on this. Then Stephanie C, she is also a nurse, and her work is she has taken the initiative of educating the health professionals how to reduce on their behalf, how to reduce the effects of climate change. She assists the hospitals to enhance resilience for changing climate. Just now, Punita Lakshmi Madam was speaking about the buildup of resilience. That's what is needed for better mental health and to treat this cause and improve their response to extreme weather events. Now, coming back to the Indian scenario, you will be surprised to see this. One recently, in 2021, one survey was conducted in 6 northern states of India on climate change conducted among health professionals. Health professionals included all. And the result showed that 85% of them believed that the health sector has the responsibility to address the climate change. See this? Out of all surveyed, all health professionals, doctors, nurses, ASHA workers, all, even the students, when they were surveyed, 85% believed that the sector has the responsibility to address the climate change. Now, if you see personally differentiating the health professionals, 97.5% doctors believed, yes, we have the responsibility. 94.8% healthcare students believed, yes, we must be involved in those climate change activities. 94.3% hospital administration staff even believed that, yes, it's our responsibility. Even 92.5% ASHA workers believed that it's our responsibility. But you see, when it came to nurses, even less than ASHA workers, nurses said it's almost 10.4% nurses said it's not our responsibility. Least of all these nurses believed in India. So it's our part. And I say this program is very necessary. Such programs are very necessary to make nurses aware that it is our responsibility and we are equally responsible for handling this situation as many as any other health professionals. Okay, but the question is, how can we contribute in it with our routine work? It is always said that nurses are the most busy persons, buried with work. So where are the areas which we can contribute? See, I had taken there are so many areas. If we go in a broad sense, I have selected some of very few areas where we can contribute personally. Even a single person can contribute, a whole team can contribute. I have selected only those few. So the first and best thing, before going to those changes, we'll see where we can work. A brief, already this has been spoken, but I'll just give a brief thing, because if we need to treat it, we need to go to the cause. So greenhouse gases. Gases that trap heat in the atmosphere are called greenhouse gases. Which are those gases? Carbon dioxide, methane, and nitrous oxide. These are all caused by different, these all come in atmosphere by different causes, by burning fuels, especially fossil fuels, by waste, or many things. Okay, you can see carbon dioxide is the major gas which is responsible for greenhouse gases. Greenhouse gases, what they do, when the sunlight comes, they trap that heat in them and increase the temperature. So the climate change is nothing but the increase in the temperature of Earth. So ultimately carbon, and I'm not saying only these three gases, but these are the majority ones. Still many carbon, black carbon gases and all different are there. So these are responsible. Carbon dioxide mainly is responsible. Methane, wherever solid waste is gathered, you can see some foul smell is coming. That is nothing but methane. Or you keep, what you do, you keep the waste in your house for if it is liquid waste, you keep it for some days. You will see after 3-4 days, the methane gas start getting emitted of it. So what is our role in this to combat this, especially if you want to fight against this greenhouse gases? What we can do? How can we reduce this carbon dioxide? I hope you all know the best treatment for carbon dioxide is sapling plantation, tree plantation or plantation. So sampling plantation, this is the best. Now I can say this is the best time for this workshop, because soon in the month of June, where the rainfall starts, it is the best time to start planting the samplings, the plants or the trees, what we say. We should start this. What is the use of this planting? Now, by trees or the plants, carbon sequestration occurs. What is this carbon sequestration? The trees will, as we all know, that trees absorb carbon dioxide. A tree can absorb almost 22 kilograms of carbon dioxide each year. So it is not necessary that we should plant the big trees which can give a shadow or such thing. We can work with each person should plant small plants also. Every plant has its capacity that they do photosynthesis, and there is nature that whatever carbon dioxide is there, they will inhale it and give oxygen to us. This not only reduces carbon dioxide, but this also reduces the temperature around wherever the plants are present. There will be humidity in the soil in which they are planted. They have the capacity to clean the air around them. So the best remedy what we have to treat this climate change or to prevent the further, because now as I was reading an article, it is said that we are using Earth 60% more than its capacity. What we should use 60% more. So we are with such a fast rate, we are damaging the Earth. And the best solution for this is plantation. Each of us, at least in a year, not more than at least 150 plants we should plant. It may be a small plant which we can keep on our terrace, in our balconies or in our house, or a large, as I said, the June month is coming, we should. As a NSS program officer, what pictures I have shown are displayed here, these are our own works. We go to different areas where there is open grounds and all, and we plant them, and we take the responsibility of watering them for at least 1 month if rainfall doesn't occur. If rainfall occurs, they take over. Such plants we select. And second concept, what we should focus is plastic. Now, you can see here, plastic has been migrated like anything in our daily life. Recently, we had a training program where one group was given one assignment to discuss about plastic. They were saying how to prevent plastic, this and that. One person, the program was for 1 hour. One person, a senior person, was sitting silently. And when he was asked to give feedback, he suddenly told, how could you prevent plastic from our daily life? Everything we use in our, see, our pen is plastic, our bottle is plastic, our glass is plastic, our daily belt is plastic, everything we cannot, our files are plastic, everything. And moreover, the bags are most important. The bags what we are using are plastic. So plastic has migrated like anything in our daily life. Now you can see the animals which are eating plastic, and the plastic garbage is like anything. And moreover, the thing is, whatever plastic we use, most of it is dumped in seas, and you can see this whale is just vomiting a large amount of plastic. So plastic has indulged, it has migrated like anything. And currently, the polythene bags, about which are less than 50 microns, are banned in our country. But why 50 microns? It is believed that if it is less than 50 microns, it is not able to be recycled. Does it mean all the other plastic what we use, like bottles and everything, will it be recycled? But a study shows that only 5% of the total waste generated is recycled. Can you imagine this? 95%, it is all going to seas and dumping areas where this plastic is not at all recycled. We say, so I am using a plastic which can be recycled. I say that, but is it recycled? It is good to eat करेला खाना चाहिए, करेला खाने से सेहत अच्छी होती है, अच्छी बनती है, लेकिन करेला खाना चाहिए ना, तब तो सेहत अच्छी बनेगी. So it's like that. We are using plastic saying that it will be recycled, but it is not recycled. It is going to the dumping areas, it is going to the seas. And the most crucial thing, disastrous thing which is happening to plastic is plastic incineration. Plastic is burned. In the morning during inauguration, Dr. Daljit sir was saying that everywhere 90% of we are inhaling this polluted air only. This plastic is everywhere. Recently, a Dutch article was published. You must all have read it because it made a news a lot last week only. It was found that traces of plastic were found in human blood. Traces of plastic were found in human blood, because once the plastic is burned, it will not go anywhere. It will remain in the air and we inhale it. We are drinking plastic. We say, I take paper cup and drink, and it is plastic free. But if you see properly the paper cup, the internal coating will be of thin plastic. The paper cups are more dangerous than plastic cup because plastic cups have thick plastics. But the paper cups will have thin plastic inside them, coated inside them. That is more dangerous that we are drinking plastic. Our bottles are plastic continuously. You can see in the picture, bottles are the most common things. First one is the plastic bag, and bottles are the most common things which are used in the form of plastic. So this is increasing the pollution in the air, and ultimately what happens when the plastic is burned? Burning plastics release a black carbon. I was telling you about carbon dioxide, which causes the green gases and increase the temperature. But if you see this black carbon which is emitted from the plastics, the global warming potential of black carbon is up to 5,000 times greater than the carbon dioxide. It is 5,000 times greater than carbon dioxide of causing. This is the basic cause why the climate is changing so badly. Climate is changing, snow is melting, sea level is increasing. So what is the best remedy if you want to treat plastic? Best remedy is don't use plastic. You yourself, I myself, what we should do is first leave plastic bags. Everywhere you see, we go for children, toys are made up of plastic, pens are made up of plastic. So many things are continuously plastic. So first keep in mind, have a principle that it's not possible that I minimize, I totally ban plastic in my life. It's not possible because so many things are there which we cannot avoid. But we should try to minimize it as much as possible. Carry paper bags, carry boxes, steel boxes, whenever you want to take something. You may not believe, in our areas, in rural areas, even the sambar, the hot things, they are directly, the tea they are packed in polythene bags. And here only in our own hospital, we see that in the back areas where small tea stalls are there, the family members will go to bring tea and all for the patients and all, and they are all packed in plastic. We tell them so many things, they say we are helpless. So we should try to minimize as much as possible from first our behalf, and then we can generate awareness. First, stop using plastic bags. Now, Government of India is taking a very good step. As per Central Pollution Control Board of India, polythene bags of less than, now presently 50 microns, less than 75 microns in thickness will be banned from September 30th, 2022, and then 120 microns will be banned from December 31. And not only this, seaweeds are there are still inventions going on. Shortly, about in a year, we will see that these plastic bags are also will be replaced by other things. We are saying banish, stop using the products from China. I have been saying so many products of plastics are coming from China, either this way or that way. Stop using plastic. And one of the good measure, we see that our Indian Railway of India, it has adopted one measure. Rather than plastic cups, they are serving in the mud cups like that, which is one way a good thing in practice. So this is about plastic, which we should stop using because it is a very, very dangerous. This what we can do. We can plant the samplings, we can do tree plantation, we can reduce the use of plastic, one measure which can be adopted. Then one of the basic measure as a NSS program officer, what we do every year. Now we'll start in the month of May with the panchayats and all, we'll discuss, and we do this every year, that we'll develop awareness regarding rainwater harvesting. This is very, very important because if you see, a recent survey shows that about 90,000 square kilometer area, which was for drinking water, which was for water to use, it has been dried. 90,000 square kilometer area. Recently, there was an article about a person from Bangalore who was an engineer in 2017. He left his job and he's working on lakes. See, you'll be surprised to see this. In 1960, Bangalore had 290 lakes which provided drinking water, 290. In 2017, I'm not talking about 2022, 2017 survey showed, when he left his job, he is telling his story, 2017, out of 290, there are only 90 lakes. Can you imagine? Only 90 lakes are remaining, means about 60% of lakes have dried off in these 57 years. So think what happens in next 50 years. The best remedy nowadays, because whatever rainwater comes, most of this goes to the drainages, then it goes to sea. So that has to be used properly. If you have an NSS branch in your institutions, or if you are working like community postings, during community postings and all, you should have this part in, you should plan camps on rainwater harvesting, simple rainwater harvesting with smaller tanks, or in villages with bigger areas, it can be done, and it is very, very beneficial. It has even there for planning such things, there is government subsidy which can be used. And you'll be surprised with this data, why we should focus on rainwater harvesting or securing water. It is recent data from WHO. Globally, at least 2 billion people out of 7.6 billion, our whole population of Earth is 7.6 billion. See this, even more than 25% of people globally, at least 2 billion people use a drinking water source contaminated with feces. Microbial contamination of drinking water as a result of contamination with feces poses a great risk to drinking water safety. See, this is thing what is happening. I don't say it is in India, but it is there in some parts of India where still there need to be done a lot of work on these things. Now, I am discussing only things as a nurses, what we can do. Okay, so the harvested rainwater, it can be used for many purposes. Okay, when we were small children, we never used to see filtered water. We used to, in schools and all, there used to be big tanks, and we used to drink from those directly from tanks. There was no filtration, there was no nothing. And if you see the tanks from below, they used to appear green and all. But we never had any infections and all. Rather, I would say we'd have developed immunity. Everywhere now, the thing is of the clean water, the pure water, everything. I don't say we should not drink the mineral water only. We should drink. But I'm saying how the concept has changed. The water has drained, and whatever remaining water is there, that is much contaminated and must be filtered and unavoidable. If we compare now the present children and what at our time, we had less infections. Even now also, if you go somewhere outside, we won't get infection that easily. But present children, they are easily infected with dust. With a minimal exposure, they'll get infected. This changes in what happened. So because of scarcity of water. So rainwater harvesting is one more very, very beneficial thing what nurses can do, because being a community health nurse, when we go to the villages and all rural areas, we should adopt this strategy. One day we should have a camp on educating, developing awareness on rainwater harvesting. And of solar panels, solar energy, we know that other sources of energy nowadays, we see many different types of power plants, thermal power plants, which are destroying the land area, which are destroying the climate, which are destroying the air around them. So now houses can be easily, again with government subsidy, many houses can have this, where they can have solar panels, and that can be used not only in Karnataka. There are so many examples where because we will have so much of hot temperature here, solar panels are installed on the roof. Not only they use for their own house, but even they sell it to our electricity board. Such examples are there which can be utilized, and we can use our groups and all for generating such awareness. Then it is most common to use wood as a fuel in our villages still. What is happening? India is home for more than 240 million households, out of which about 100 million households are still deprived of LPG and cooking fuel and have to rely on firewood, coal, dung cakes and all. Now, when we go to villages, I'm sharing you my experience. When we go to villages and tell them don't use wood as a fire, or don't you use LPG gas, they say from where we'll purchase? We don't have money and all. We cannot afford this. And recently government has even cancelled the subsidy. The LPG rates are so high. But when you compare the cost effectiveness, when you say that this using of wood can cause what? It can cause many respiratory diseases. And when you compare the hospital charges, the consequences of using such things on their surrounding environment, on their own health, and that will cost more to them compared to using LPG cylinder now, that will be more beneficial, the way we can teach them, and that this should be minimized. This will releases again the carbon dioxide, the black carbon in the environment, again adds to the climate change. And we can have awareness. I just briefly, I told you wherever we can work. There is a lot. Climate change, this is an enormous area where we can work. So we can have awareness campaigns on saving electricity. Ultimately, it is a cycle. More electricity, more loss of or the release of such gases and all while production of electricity. So saving electricity, saving water, we should have campaigns on this, not to waste water. Segregation of waste, government is telling so much. The wet waste and the dry waste must be separated so that we can for making manure, the wet waste can be used, or we can, once it is mixed, even the dry waste cannot be recycled. So segregation of waste, where we can make awareness campaigns and tell many people what are the benefits of doing that. Even we can use that wet waste in our own backyards, where we can prepare the fertilizers, the organic fertilizers and all. Reduce use of plastics. We can do awareness campaigns on that, and reduce idling of vehicles. We keep our vehicles for in signals and all, 1 minute, 2 minutes, they are kept on only. That should be reduced. That little we think isse kya hoga, thodi der mein 1 minute se kya hoga. But the same thing, if some 100 crore people of our country think, usse to bahut kuch hoga. That we should understand. So if I take an initiation, then ultimately all will take. So use non-pollution causing means of transport. Try to reduce, if it is nearby, walk, use a bicycle if for any other works, or carpooling can be done rather than every individual riding a car. Carpooling can be done. Such measures can be used. And lastly, respect and protect the green places. That can be done wherever green places are there. Now, urbanization, what it has done, all the greenery they'll destroy. And it is obvious because everyone wants a house. We cannot avoid that. But when you cut one tree, at least plant 2 trees. That should be done. That should be the practice. In near Bagalkot, one such program was going on where they were widening the roads. And people protested against it. And they said, okay, you cut off, no problem. But instead of 1 tree you are cutting, you should plant at least 2 trees out of it. 2 plants you should, and you should take care, they should be grown. You should water them. Then they released the strike, and that was brought into practice. And still I am saying, again, greenery is the best solution for this. Plant, small, don't go for big, because big things, small things can bring great changes. That happens most of the times. Okay. And most importantly, what needed is for our country is population control. We can do as many as can be. These are all going on. We are working, all of us are working on this, but still there is need. The rate with which our population is growing, and obviously there will be scarcity and of such things that can occur. And how we can work. There is one fine association, Alliance of Nurses for Healthy Environment. We can join to such associations. We can create. Now the students are very fast. I see my own students here. They are so experts in softwares. They are so experts in applications. They build their own groups. So such groups can be built. The young ones should come forward and look forward, because you are the one who are going to face after 20 years. Ma'am was telling what will happen in 2050, what will happen in 2070. So many drastic changes can be observed. You are the one who should take more initiation for forming such groups. So talk about the changes you make. That is more necessary. And to end my program, I'll tell all of you are aware of this Dandi March, which occurred in 1930. This is the march because of which we are getting nowadays. Salt is the most basic thing we need every day. And in India, salt is free because of, at the time of British rule, salt, they had tax for salt also. If that was the condition, we would have bought it for much heavier cost now. Salt would have been very costly, because that is the most basic need. Because of this Dandi March, what I want to tell, what message I want to give from this is, because always what we believe is what I can do, what alone I can do, what we few can do. But when you start some cause, when you start something, again, automatically when the people see benefits of it, they go on joining. This march started by Gandhiji on 12th March from Sabarmati Ashram from Gujarat. It was almost 395 kilometers they had to reach Dandi. 395, they started that march, and when they started, there were only 78 followers. It is recorded, even the names of 78 followers is given. Only 78 followers were there when they started the march. And when they reached Dandi, on the way there were thousands of men who met them. But when they reached Dandi, there was, when he started the march, Gandhiji, when he started the march, then the British ruler said, what will happen? Give a bag of salt to him, he will stop. Because there were less members. They didn't bother about it at all. But when they reached Dandi, there was 50,000 people behind Gandhiji when they finished that Dandi March on 6th April. This is when we take initiation of something. And still now, 1930 to still now, almost 92 hours, we can see we are having the benefits of that cause. So we should come forward. We should take stand for such causes, and we should prove ourselves. And nurses, as I told you, we are the most trusted one. We are in quantity, we are high. If we take initiations, we can do much more things. Okay. And I am very thankful for giving me such an opportunity Manpreet ma'am contacted me. Manpreet ma'am believed in me. I don't know if I could have done justice, because to this, with such a, I saw all the resource person with such a huge, enormous experiences, and I learned there is a still long way for me to go, to so many things to prove. And I am really thankful to the management and all the team, principal of Sri Guru Ramdas College of Nursing, for giving me this opportunity. And I thank you one and all.
So thank you so much, sir. And I must say, very informative session and very relatable examples sir has talked about. And one thing we need to really appreciate being nurses, that what sir has said in the beginning, and that really requires an applause, that nurses are the most trusted professionals, quality-wise, of course, and what sir was saying, quantity also. We are the biggest workforce in healthcare system, and yes, we have the opportunity to make a difference. Whatever phenomena, whatever aspect comes in front of us, like the climate changes we are talking about. So thank you once again very much, sir, about your wonderful session. And now it's the time to have question and answer. And if there is any discussion, the participants who have joined virtually, they can write their question in chat box, or they can raise their hand. Then we will unmute them. And if they want to have any discussion, that can be done. Even the participants who are sitting over here, if they want to give some feedback or say any question, most welcome. Okay, so now time is running, and already we are late. So I will just conclude that there are no questions on, and there is one feedback form which is placed in the Zoom meeting as well as on the YouTube link, and it will remain active till 5 o'clock. The students who are sitting over here physically, they can fill up that form that will be available on the YouTube link, which is already given to you. You can fill up that feedback form till 5 p.m. to get your certificates. So once again, all the participants, make sure that you are giving the feedback on the link provided. So that was all about E-Symposium, and the take-home message from all these sessions. I will just say in Hindi one quote, which I found very interesting, which is very much relatable. भविष्य तो हरा होगा या नहीं होगा. So that's what the message we have to carry, and of course we have to implement. All these measures are very practical, very relatable, and of course very easy. And what sir was also emphasizing, that single effort also counts much. And of course, the universe is counting every single effort of ours. So that really matters. As one of the Hindi saying also, like मैं अकेला चला और कारवां बनता गया. That's how the things could really change. So thank you everyone. Thank you all the speakers for all these wonderful deliberations and for wonderful sessions. Very informative, very explanatory. So over to H.O. Thank you. So as now it is the time to declare the results for mind map competition, I request ma'am to please announce. Ma'am, please announce the results. Okay, so once again I'm here. So the most awaited moment, I must say, of all this event, that is mind map competition. So this competition was announced as a part of this World Health Day celebrations, and we had received 16 entries from different states of India about this man-made competition. And I will not take much of your time. So let's have a look at the prizes first of all. These were given in the brochure, but once again, just to, so first prize is 3,000 rupees lifestyle gift voucher. So this will be valid for 1 year. You can use, the winners can use this gift voucher in the next 1 year for their shopping. So that is for the first prize, 3,000. Then along with that, each winner, first, second, and third prize winner will get a book called as Success to Key by JP Publishers. That's a complimentary book for all the winners. And also online access to the e-library of Walter's Kluwers. So these 3 prizes will be given to all the winners. So first prize, rupees 3,000 gift vouchers plus all these access and a complimentary book that goes to the next slide, please. Can we have a look at the mind map, which has got a first prize? Yes, so it's there on the screen. You can see this mind map has got a first prize, and the prize winner is Miss Angel Alfonza Zos from Bombay Hospital College of Nursing, Indore, Madhya Pradesh. Earlier in the morning, I saw she has joined the meeting. So if she's still there in the Zoom meeting, so a lot of congratulations to her for winning this prize. Second prize. Next slide, please. Second prize, again, 2,000 rupees lifestyle gift voucher plus free book, Key to Success, and e-library resources. So any 2 books can be chosen from that. So second prize goes to Ms. Ritika Arjun Suki from Leelabhai Thackeray College of Nursing, Mumbai. Lot of congratulations to her also. And this is the mind map you can see on the screen. This was prepared by her, second prize. Now the third prize. Third prize, 1,000 rupees gift voucher from Lifestyle, and also the online access from e-library and complimentary book, Key to Success. Third prize goes to Ms. Jaswant Kaur. So that's the mind map prepared by her from SGRD College of Nursing, Amritsar. So right now she's sitting with us. So lot many congratulations to her. So very nice effort. I was just looking at all the mind maps which were submitted. Very nice and very creative. And once again, congratulations to all the winners and all the participants for mind map competition. And thank you for participating, and thank you to our judges also who have evaluated. I know one of the judges was saying she has spent around 6 hours to look at those mind maps and then give the final judgment. So thank you to all our judges for evaluating these and all the participants. So thank you once again. Now I invite Ms. Kawaljeet Kaur from Department of Community Health Nursing to please extend vote of thanks to our audience.
Thank you, Ikshut ma'am. Good afternoon, everyone. I, Kawaljeet Kaur, on the behalf of Community Health Nursing Department, Shri Guru Ramdas College of Nursing, express my thanks to everyone who contribute to organize this event. Firstly, I express my heartfelt gratitude to the Dr. A.P. Singh, Dean, Shri Guru Ramdas University of Health Sciences, for his regular help and reinforcement to the college. Then my thanks goes to our esteemed Vice Chancellor, Sir Dr. Daljit Singh, who enlightened us with his knowledge and expertise. I express my sincere thanks to our principal, ma'am, Dr. Parvez Saini, for her continuous guidance and support. I extend my thanks to our HOD, Dr. Manpreet Kaur, for her sincere efforts to organize this event. I extend my thanks to all speakers and guests who participate and made this event a success. I extend my thanks to computer operator Harinder Singh and Jaspreet Singh for helping us to organize this event. I extend my thanks to our sponsor to providing exciting gifts to the winner of mind mapping. And at last, my special thanks to the all faculty students for their contribution. So thanks you one and all.
Thank you everyone for joining us today. Now you can leave the meeting. Thank you.